What happens during a stroke? Every 2 seconds, someone somewhere in the world experiences a stroke. And 1 out of 6 people will have one at some point in their life. Strokes deprive brain cells of oxygen, and one of the most common causes of death and a leading cause of preventable disability. When someone experiences stroke, quick medical care is critical and often helps avoid permanent brain damage. But what causes a stroke in the first stage? What can the doctor do to treat them? The brain makes up just 2% of your body's mass, but consumes more than 20% of the oxygen in your blood. That oxygen is carried to the brain through a system of arteries. Carotid arteries supply the front of the brain, and vertebral arteries supplies the back. These are connected to each other and divide into smaller and smaller vessels that get billions of neurons the oxygen they need. If the blood flow is contracted, oxygen delivery stops and brain cells die. There are 2 ways this happens. Hemorrhagic stroke are one of the primary vessels allow the blood to leak out, but the more common type is the ischemic stroke, when the clot blocks a vessel and drains blood flow to heart. Where these clots come from? On rare occasions, such change in the heart rhythm prevents the upper chamber of the heart from contracting normally. This slows down blood flow, allowing the platelets, clotting factors, and fibrin to stick together. The clot can be carried up toward the arteries and blood vessels supplying the brain. Until it gets to one, it can squeeze those. This is thus an embolism, and it cuts off this oxygen supply to all the cells downstream. The brain does have the pain receptors, so you can feel the blocking itself. But oxygen deprivation slows brain function and can have a sudden noticeable effect. For example, if the affected area is responsible for speech, individual's word may be slower. If the stroke affects a part of the brain that controls muscles movement, it can cause the weakness, often just on one side of the body. When this happens, the body will immediately try to compensate by diverse blood flows to affect the area, but this isn't a proper solution. Eventually, the oxygen-deprived cell will start to die, leading to brain damage that may be severe or permanent. That's why it is important to get medical care as fast as possible. The first line of the treatment is intravenous medical tissue plasma activator, which can break the blood clot and allow blood to flow again in the compromised artery. If it's delivered within a few hours, this medication greatly increases the chance of surviving the stroke and avoid permanent consequences. If tissue plasma activator cannot be given because the patient on certain medications has history of major bleeding or the clot is particularly large, doctors can perform a procedure called an endovascular thrombectomy. Using a fluorescent dye that illuminates the blood vessels under the stroke, the physician insert a long, thin, flexible tube called catheter into the artery in the leg and maneuvers all the way to blocked. A retriever is passed through this catheter. It explains and anchors in the clot when it just passes. The catheter then pulls the clot out when it's removed. These treatments need to be delivered as soon as possible to preserve brain function, which means figuring out the fast if someone has a stroke. So how can we tell? Here are 3 things to try. 1. Ask the person to smile. A crooked mouth or feature drooping can indicate muscle weakness. 2. Ask them to raise their arms. If one drapes downward, that arm weakness is also a sign of a stroke. 3. Ask them to repeat a simple word or phrase. If their speech sounds slurred or strange, it could mean that the language area of their brain is oxygen deprived. This is sometimes called the FAST test, and the T stands for time. If you see any of those signs, call emergency services right away. Life may depend on it. One more. Every 2 seconds, someone somewhere in the world experiences a stroke. And 1 out of every 6 people will have one at some point in their lives. Stroke deprives the brain cells of oxygen and one of the most common causes of death and the leading cause of preventable disability. When someone experiences stroke, quick medical care is critical and can often avoid permanent brain damage. But what causes strokes in the first place, and what can doctors do to treat them? The brain makes up just 2% of your body's mass, but consumes more than 20% of oxygen in your blood. That oxygen is carried to the brain through the system of arteries, carotid arteries supplying the front of the brain, and vertebral arteries supplying the back. These are connected to each other and divide into smaller and smaller vessels that get billions of neurons the oxygen they need. If the blood flow interrupts, oxygen delivery stops and the brain cells die. There are 2 ways in this happen. Hemorrhagic stroke are the one of the pulmonary vessel allows blood to leak out. But the more common type is the ischemic stroke, when a clot blocks a vessel and brings blood flow to a halt. Where these clots come from? On rare occasions, a sudden change in the heart rhythm prevents the upper chamber of the heart from contracting normally. This slows down blood flow, allowing platelets, clotting factors, and fibers to stick together. The clot can be carried up toward the arteries and blood vessels supplying the brain. Until it gets to one, it can squeeze through. This is called an embolism, and the cause of this oxygen supplies to all the cells downstream. The brain doesn't have the pain receptors, so you can't feel the blocks itself. But oxygen deprivation slows brain function and can suffer noticeable effects. For example, if the affected area is responsible for speech and the individual's words may be slower. If the stroke affects a part of the brain can't control the muscle movements, it can cause the weakness, often just one side of the body. When this happens, the body will immediately try to compensate by diverting blood flow to the affected area, but this isn't a perfect solution. Eventually, the oxygen-deprived cell will start to die, leading to brain damage that may be severe or permanent. That's why it's important to get medical care as fast as possible. The first line of treatment is intravenous medication called tissue plasmid activator, which can break the blood clot and allow the blood to flow again in the compromised artery. If it is delivered within a few hours, this medication greatly increases the chance of surviving and avoiding permanent consequences. If tissue plasmid activator cannot be given because the patient on certain medications has a history of major bleeding or the clot is particularly large, doctors can perform a procedure called endovascular thrombectomy. Using a fluorescent device that illuminates the blood vessels under a strong X-ray, the physician inserts a long, thin, flexible tube called a catheter into an artery in the leg and maneuvers all the way to the blood. A retriever is passed through this catheter. It expands and anchors into the clot when it just passes. The catheter then pulls the clot out when it's removed. These treatments need to be delivered as soon as possible to preserve brain function, which means figuring out the fast if someone is having a stroke. So how can you tell? Here are 3 things to try. 1. Ask the person to smile. A crooked mouth of a visual drawing can indicate a muscle weakness. 2. Ask them to raise their arms. If one drift somewhere, that arm weakness is also a sign of a stroke. 3. Ask them to repeat a simple word or phrase. If their speech sounds slower or strange, it could mean the language area of their brain is oxygen deprived. This is sometimes called FAST test, and the T stands for time. If you see any of those signs, call emergency services right away. Life may depend on it.